So next topic is vasodilators. So what is the vasodilators means? These are used for the various conditions like hypertension, angina pectoris and cardiac failure. So what it will do means it will dilute the blood vessels and it will increase the blood flow to the constricted blood vessels. Means if we see in the heart, the blood is blocked due to the presence of the cholesterol or the narrowing of the blood vessels. So by that way that the heart will get blocked. So the vasodilators, what it will do means it will dilute the blood vessels and increases the blood flow, and also it will decreases the arterial and the venous pressure. Means it will decreases the pressure of the arteries and the veins. So if the pressure is decreased means then followed by the pressure has been decreased in the myocardium. Finally, what will happen means the demand of the oxygen by the heart is also be decreases. Here is nothing but it will dilute the blood vessels and increases the blood flow to and also it will decreases the pressure of the arteries and the veins, and also it will decrease the pressure which has been work done by the myocardium. And finally what will happen is the heart will get the sufficient amount of the oxygen. It will get the sufficient amount of the oxygen, so the heart need not to get more stress. So this vasodilators are used to balance the oxygen and what are the requirement of the oxygen by the heart. So it will balance the demand of the oxygen by the heart. So the compounds which include the coronary vasodilators will dilute the coronary vessels. Means it will dilate the coronary vessels and the blood can easily flow in the heart. So if you see here of the heart, means in the arteries have the muscles. So what will happen is based upon the constriction or the non-constriction, the blood can easily flow. If the blood vessel has been constricted more, means the blood flow will be decreases in the heart. See here, if it is more constricted, means the blood cannot able to flow easily. But if we use the dilation drugs, means the blood vessels will get relaxed and it will get expand. Here see, we can see here expansion form, so the blood can easily flow. So by using the AC inhibitors and vasodilators, the drugs can be used to expand the blood vessels in the heart and for the easy and the free movement of the blood. So in the video we have already seen that how the blood vessel is functioning, and when it is undergoes the constriction of the blood vessel, the blood flow is decreases and formation of the clot. And also when the vasodilators drugs has been used, means the blood vessels become wide and the blood can easily flow in the heart. So that there are three categories in the vasodilators. First one is organic nitrates or nitrites, is also known as short acting compound. Next one is long acting compound, and third one is peripheral coronary vasodilators. So these are the three subcategories which comes under the vasodilators, that is organic nitrates or nitrites, long acting compound and peripheral coronary vasodilators. So first one is organic nitrites and nitrates. So in this what will happen means The esters formed due to the reaction between the esters are formed the reaction between the organic alcohols and the nitric acid. So the reaction is formed between the alcohols and the nitric acid is known as organic esters. So chemically they are considered as the nitrate esters. So all the compounds must include the reaction of the isoamyl alcohol with nitrous acid. So the organic nitrates or nitrates are very useful in treating means relaxing of the angina pain. Means it is most useful to reduce the pain during the angina pectoris, because this nitrates will converted into the nitric acid, nitric oxide. So this nitric oxide is responsible for vasodilating activity. Means vasodilating means it will widen the blood pressure and also clear the clot present in the heart. So but this pure drug cannot be used because it has the explosive nature. So only the diluted preparation should be recommended. And the drugs which comes under the organic nitrates or the short acting drugs are amyl nitrile and nitroglycerin. First one is amyl nitrile and next one is nitroglycerin. Next general mechanism of action is, if we administer the drug, the nitrates is converted into the nitric oxide. So the nitrates is converted into the nitrites. The nitrites will release the nitric oxide. So it will activate the cytosolic guanyl cyclase enzyme. Means it will activate the cytosolic guanyl cyclic enzyme. So if this enzyme is activated, and it will lead to the increase in the production of the GMP and cGMP. Finally, it leads to the dephosphorylation of the myon light chain. So if the dephosphorylation occurs, it leads to the smooth muscle relaxation. So if the muscles has been relaxed, means there is no pressure in the heart and the heart can function normally. I will explain it again. The nitrates is converted to nitrites, and which releases the nitric oxide. So nitric oxide is responsible for the reducing the pressure in the heart. So this nitric oxide will release the cytosolic guanyl cyclase enzyme. Cytosolic guanyl cyclase enzyme will release. So this enzyme is responsible for increasing the GMP and cGMP. So it will lead to the dephosphorylation of myon light chain. So if the dephosphorylation occurs, leads to the smooth muscle relaxation. So this is the general mechanism of action of organic nitrites. Next, SAR. If you see in the structure, the ester group should be present. It must be present because it will relieve the angina pain, and also it have the lipophilic character, so that it can easily bind to the lipophilic barriers and reduce the pain. So the ester group should be essential to reduce the pain of the angina pectoris. And if the drug has the hydrolysis bond, means it is in the moisture form, means the therapeutic activity will be decreases. So the drug should not be with moisture. If it is with the moisture, means activity will be decreases. The compounds with high partition coefficient is more potent than with the low values. So if the partition coefficient is high, means the compound is also good. So common adverse drug reaction is weakness, dizziness, palpitation means the heart irregularities, heartbeat irregularities, facial flushing, decrease in the blood pressure. Continuous use may lead to the drug dependence. Means if the person is continuously using the drug, means he will continuously depend upon the drug. Means without the drug he can't able to live. And sudden death. Uses: it is used in the treatment of the angina pectoris, congestive heart failure, and myocardial infarction, left ventricular fibrillation, and many others are diseases which are related to the heart. So it is used to treat in the different heart diseases like angina pectoris, congestive heart failure, and myocardial infarction. Also, it is used to in the treatment of the cyanide poisoning. Means it acts as the antidote for the cyanide poison. Next, first drug is amyl nitrite. So this is the structure of the amyl nitrate, and IUPAC name is pentyl nitrite or 2-methyl butyl nitrate. So we can write any of the one IUPAC name. So if you see the pentyl nitrate means in structure 1, 2, 3, 4, 5. 5 carbon atoms are there. So it is pentyl, and this is the nitrile. So pentyl nitrite or 2-methyl butyl nitrate. See here in second position, methyl group is there, and 1, 2, 3, and 4. 4 carbon atoms are there, means butyl. In second position, methyl is there. So 2-methyl, and this is butyl, and this is nitrate. So properties: it is a clear yellow liquid, and it having somewhat fruity odor or aromatic taste, and it is very slightly soluble in water and miscible with alcohol, acetone, and chloroform. Next, pharmacokinetics: it is the oral, means if oral route of administration is slow, so it is better to take through the nasal, means nose. So through the nasal route of administration, and it is metabolized in the liver. So the organic nitrates are converted into inorganic nitrates. So that are means metabolized in the liver, and it is excreted in urine. So I will explain it again. Oral route of administration is very low. So we should take through the nasal route of administration. It is metabolized in the liver. So in liver, what will happen? The organic nitrate. So basically this drug belongs to the organic nitrates. So organic nitrates are converted into the inorganic nitrates, and it is excreted through urine. So adverse drug reactions: headache, dizziness, flushing of the face, lightheadedness or fainting, involuntary urination, low blood pressure, nausea, vomiting, shortness of breath, cold sweat, pale skin, rapid heart rate, restlessness, weakness, or slow breathing. Next, uses: it is used in the treatment of the various heart diseases like angina, and also it is used as an antidote for cyanide poisoning. Next, dose: it is taken in the form of inhalation. So 0.3 ml should be taken. Next, it is used means for the angina pectoris, that 0.3 ml by inhaling. We should take for 0.3 ml for 3 to 5 minutes. Next, if in case of the cyanide poisoning means 0.3 ml ampoule should be crushed and placed in front of patient mouth. If the patient will inhale over 15 to 30 seconds, means here it should be means it is used for the cyanide poisoning. So if the drug is given, means it acts as the antidote in the case of the cyanide poisoning. That should be 0.3 ml should be taken, that in the form of the inhalation, in order to remove the poison from the body. So next, nitroglycerin. This is the structure of the nitroglycerin. If you see the IUPAC name, 1, 2, 3, propane, triol, trinitrate. See here 1, 2, and 3. 3 carbon atoms are there. So it is propane, and 1, 2, 3. So for 1, 2, 3 positions of the carbon atom, 3 oxygen atoms are there. So it is known as triol. So 3 carbon atoms are there. So it is triol. How many nitrate atoms are there? 1, 2, 3. So trinitrate. 1, 2, 3, propane, triol, trinitrate. And properties, it is the pale yellow oily liquid and it is sweet burning taste and poorly soluble in water, sparingly soluble in petroleum products. All petroleum products, it is sparingly soluble. Next, if you see the synthesis, this is the structure of the glycerol. When the glycerol in presence of the nitric acid and sulfuric acid. So we will get the nitroglycerin. See here, here the 3 hydrogen atoms will get replaced with the 3 nitro atoms. 3 hydrogen atoms are there, no? H, H, H. So this will get removed. In this place, the 3 nitrogen atoms will get attached. So by this way, the glycerol will get converted into the nitroglycerin in presence of the nitric acid and sulfuric acid. So next mechanism action, what will happen means nitroglycerin is converted into the nitric oxide by using the enzyme mitochondrial aldehyde dehydrogenase. So this nitric oxide will activate the guanidine cyclase. So after activation of this enzyme, what will happen is CGMP will get synthesized. So CGMP means cyclic guanosine 3,5 monophosphate. So it will lead to the activation of the protein kinase dependent phosphorylation in the smooth muscle. So if this enzyme has been activated in the smooth muscle means finally it leads to the relaxation of the vessels and increase the blood flow in the veins, arteries and cardiac tissue. So I will explain it again. Here see nitroglycerin is converted to the nitric oxide by using the enzyme mitochondrial aldehyde dehydrogenase. So the activation of the enzyme, what will happen is the enzyme guanylyl cyclase will be activated and it will leads to the formation of the CGMP. The CGMP will be activate the kinase dependent phosphorylation in the smooth muscle. So it will lead to the relaxation of the blood vessels and increase the blood flow in the heart. So this main functioning of the drug is to reduce the blood pressure in the heart and increase the blood flow. Next, pharmacokinetics means it is the oral, sublingual and transdermal route of administration and it is metabolized in the liver to the nitroglycerin is metabolized to the nitrate, that is 1,2 glyceryl dinitrate and 1,3 glyceryl dinitrate. So it is converted to this nitrate metabolites and it is finally eliminated through the body. It is oral, sublingual, transdermal route of administration. So it is metabolized in the liver to the nitrate compounds, that is 1,2 or 1,3 glyceryl dinitrate and it is metabolized, it is eliminated from the body. So adverse drug reactions are headache, weakness, dizziness, lightheadedness or fainting means feeling of the fainting, nausea, flushing and mild burning in the mouth, flushing or redness under the skin. So next therapeutic uses, it is used in the treatment of the angina, acute myocardial infarction, hypertension and coronary artery spasm. Dose 2.5 to 6.5 mg per 8 hours, 6 to 8 hours a day. So next, these are the 2 drugs which comes under the short acting, that is nitroglycerin and amyl nitrite. Next B is long acting compounds. So in this, what drugs will come means isosorbide dinitrate, Pentaerythritol tetranitrate and isosorbide mononitrate. So first one is Pentaerythritol tetranitrate. So this is the structure of the Pentaerythritol tetranitrate. So next, here IUPAC name is 2,2 bis nitroxymethyl propane 1,3 diol dinitrate. If you see in the structure 1, 2, 3. So 3 carbon atoms are there, means it is propane. So in the second position, 2 nitroxyethyl groups are there. See in second position, here one nitroxy group, here one nitroxymethyl group is there. So how many are there? 2. So it is named as 2,2 bis nitrooxymethyl, and this is the propyl in first position, and the third position 2 oxygens means 2 diol is known as diol, and 2 nitrate groups are there, that is dinitrate. So I will explain it again. 1, 2, 3. So 3 carbon atoms are there, means propane. So in the second position 2 nitroxymethyls are there, that is bis nitroxymethyl 1,3 diol means oxygen dinitrate. Properties are, it is white crystalline solid and it is with mild odor, and it is soluble in the acetone, sparingly soluble in alcohol, ether, very slightly soluble in acetone, soluble in benzene, pyrene and toluene, slightly soluble in methanol. So pharmacokinetics are, it is the oral route of administration and it is metabolized in the liver. And the metabolites are pentaerythritol trinitrate, pentaerythritol dinitrate. So these are the two metabolites, that is pentaerythritol trinitrate and dinitrite and mononitrate. So it is finally eliminated through urine. So it is oral route of administration and it is metabolized in the liver and eliminated through urine. So adverse drug reactions are skin irritation, headache, dry mouth, blurred vision, and renal failures, liver problems in elder patients. That means the elder patient is not safe for using the nitrates. Next, therapeutic uses, it is used in the treatment of the various heart conditions like anti-anginal and congestive heart failure, and but also it is also used in the preparation of the bombs. It acts as an explosive. And use dose means, if it is in angina pectoris means 10 to 20 mg 4 times a day. Means we should take the 10 to 20 mg 4 times a day daily. And if it is erythral tetranitrate means 10 mg oral should be taken. Means that should not be more than 100 mg per day. So next, isosorbide dinitrate, and this is a structure. If you see the IUPAC name, 3,7 dihydro, 2,6 dioxynitrate digluticol. So if you see here, this is the structure of the gluticol. In the third and seventh position, hydrogens are there. How many? 2. So it is named as the 3,7 dihydro in 2,6 dioxynitrate. So in second position and the sixth position, oxynitrate are there, and this is the structure of the gluticol. So in 3,7 dihydro, 2,6 dioxynitrate gluticol. So it is the hard colorless crystals and it is odorless and soluble in water, freely soluble in organic solvents, acetone, alcohol and ether. So synthesis, it has 3 steps. In the first step, the D-glucose undergoes the hydrogenation in presence of the platinum, means catalyst. So it just involved in the reaction that to speed up the rate of reaction only. So to form the disorbitol, see if you see the structure of the D-glucose, here only aldehyde group is present. So here 2 of the hydrogen atoms will get attached here to form the disorbitol. See here, here aldehyde group is there, and here the 2 hydrogen atoms are replaced. So next step is desorbitol in presence of the concentrated sulfuric acid to form the isosorbide. So here what will happen means the water molecule will get eliminated from the desorbitol to form the isosorbide, and here water molecule is eliminated in presence of the sulfuric acid. Next, third step is isosorbide in presence of the nitric acid and sulfuric acid, means it undergoes the nitration. So here in the second position and the sixth position, the hydroxyl groups are there. So here the two hydrogens will get eliminated, and in place of the hydrogen, the nitro groups are attached to get the isosorbide dinitrate. Next mechanism of action is this drug is converted to the nitric oxide. So it is converted to the nitric oxide to activate the guanylate cyclase, and this will increase the cGMP levels. So finally it leads to the dephosphorylation of the myosin light chain, and it leads to the relaxation of the smooth muscle. So it is same equal to the general mechanism of action, nothing. The drug is converted to nitric oxide and it will activate the guanylate cyclase enzyme. So it will increase the level of cGMP, and this cGMP will lead to the dephosphorylation of the myosin light chains, and finally it leads to the relaxation of the smooth muscles. If the smooth muscle has been relaxed, means the blood can be easily flow from the heart, and also there is no pressure on the heart. Next, pharmacokinetics. It is the oral route of administration, and it is metabolized in the liver and excreted through urine. Next, adverse drug reactions are headache, dizziness, lightheadedness, means feeling of the fainting, lightheadedness, fast or slow heart rate, worsening of angina pain, means the angina pain will be increases more by using this drug. Blurred vision, dry mouth, flushing, and changing the skin color, shortness of the breath. Next, therapeutic uses. It is used in the treatment of the various heart diseases like coronary artery disease, angina pectoris. So what it will do means it will relax the heart vessels and it will widen the blood vessels for the easy flow. So this medication which comes under the nitrates. Next, dose is 5 to 20 mg orally 2 to 3 times a day if it is intermediate release, and 40 to 60 mg per day oral route. So next, peripheral coronary vasodilators. So it is subdivided into two types, that is potassium channel activators and other peripheral vasodilators. So in potassium channel activators, first one is nicoridine, minoxidil and diazoxide. In other peripheral vasodilators are dipyridazole and papaverine. So these are the drugs which comes under the peripheral coronary vasodilators. So drug is dipyridamole. So drug name is dipyridamole. This is the structure, and if you see the structure here, IUPAC name 2, 2, 2, 2 means 2, 4, 8 dipyridine, pyrimidine, 2, 6 dinitro tetraethanol. See, if we here structure 2, 2, means here in the second position 4 ethanol groups are there. So it is 4 2s are present. In the fourth position and the eighth position, pyridine structure is present, and this is the structure of the pyrimidine. In the second position and the sixth position, 2 nitro atoms are there. So and also 4 alcohol ethanol groups are there. So it is named as 2, 2, 2, 4, 8 dipyridine, and this is the structure of the pyridine. And in second position and so for sixth position, nitro groups are the dinitro tetraethanol. And properties are, it is a bright yellow color and it is almond or methanol flavor, and it is oral route of administration, and it is metabolized in the liver, excreted through urine. Adverse drug reactions are dizziness, stomach upset, diarrhea, vomitings, headache, and flushing. And therapeutic uses, it is used in the treatment of the various heart diseases like coronary artery disease and congestive heart failure and anginal pectoris, and also it is used to reduce the blood pressure. So these are the uses which comes under the drug. Means it is useful to treat the all cardiovascular diseases, and the dose should be taken 75 to 100 mg 4 times a day. And this drug should not be taken along with the aspirin. Means this drug should be avoided in combination with the aspirin.